Dictionary.com defines transgender as a person whose identity or gender expression differs from their sex assigned at birth. Transgender is an umbrella term. In addition to including people whose gender identity is opposite from their assigned sex, it includes people who may not be exclusively masculine or feminine. With that being said, today I would like to talk to you about transgender athletes. The main points I will cover are the biology of males and females post-puberty, the importance of athletics for high school students, and fair play versus gender identity in sports. First off, I would like to discuss the testosterone levels in both males and females after puberty. MedHelp.org states that the normal range of testosterone for a male is between 300 to 1,000 nanograms per deciliter. This enables men to have a taller stature, to have wider shoulders, to have a higher bone density. They have more upper body strength. They have more blood volume, which in turn causes a higher red blood cell count. They have a larger lung capacity. And they have a higher muscle to fat ratio. In turn, the average testosterone level for females is 15 to 70 nanograms per deciliter. This means that females will have, on average, 6% more body fat than males, 30% less lower body strength than males, and 40% less upper body strength than males. So now that we have covered the biology of the difference between males and females, let's take a look at athletic programs. In school, the national average is above 50% participation for both boys and girls from 8th through 12th grade, according to childtrends.com. Sports have proven to be a good way to bridge the gap between students who would normally not interact with each other. It's also the universal language for families across the generations. These activities provide scholarship opportunities for people who would not otherwise be eligible to go to college. Sports provide teamwork. They teach effort, determination, and self-discipline. Sports also help children put aside their individual differences to support each other and their team. Athletics provide school recognition and pride. Extracurricular activities are a powerful motivator for a student to maintain their grade point average and to stay out of trouble so that they are eligible to play on the team. My third point of the discussion is fair play versus gender identity regarding athletics. The gender identity doesn't matter. It's the testosterone levels. Trans girls should have the right to compete in sports, but cisgender girls, or females who are born female, should have the right to compete and exceed too. How do you balance that? That's the question. This is a quote from Joanna Harper, who is a medical physicist and transgender runner from Portland, Oregon. Dr. Eric Villian, a professor of human genetics from UCLA, who helped write the NCAA's transgender guidelines for sports, states, "Can you turn a man's body into a woman's body?" The short answer is no. And I think that we need to realize that the idea is to reduce the level of testosterone in that athlete's body so that the muscle mass shifts and decreases to that of an average NCAA athlete. We cannot think with the eyeball test. You can't look at a person who was born a male, went through puberty, and then transitioned. You can't just look at them with your eyeballs. You have to understand that there are testosterone levels at play. Okay? So, currently, 17 states allow high school students to compete according to the gender that they identify with. They do not have to do any kind of hormone replacement therapy. The NCAA also allows for transgender athletes. However, their athletes have to complete 12 months of testosterone suppression treatment before they are eligible to play. The International Olympic Committee allows for transgender athletes, as long as the male to female competitor has a testosterone level that is below the cutoff for at least 12 months prior to the competition. A female to male transition competitor does not have to have any restrictions. Okay? So, in conclusion, I will state this. The practice of sport is a human right. Every individual must have the possibility to practice sport without discrimination of any kind in the Olympic spirit. This requires mutual understanding with the spirit of friendship, solidarity, and fair play. This is the International Olympic Committee's fundamental principle. In athletics, I think it's important that we remember that no two athletes are the same. You can have the broadest shoulders on the field, but if you have the smallest brain, you're still going to be at a disadvantage. We have to factor in intellect and the ability to strategize. We have to factor in, what is their diet like at home? We have to factor in the athlete's own determination and will, as well as height, weight, and wingspan. For some children and some athletes, this is all they have, and we need to respect that. Tonight I have discussed, that was a little bit of a tangent. Tonight I have discussed testosterone levels in transgender athletes, the importance of athletics in students, testosterone levels, the biology of testosterone levels in both males and females, and I hope that I have brought you a new perspective on transgender issues regarding sports. Have a nice night.